Okay, welcome. Welcome to the Commission on Excellence and Innovation in Health's Innovation and Improvement Showcase. Thank you for joining us today. This showcase is Series 11 and the theme is Strengthening Healthcare Workforce Wellbeing in South Australia. My name's Nadia Masterson and I'm the Director of Partnerships here at the CEIH. I'd like to start off by acknowledging that the lands we meet on today are the traditional lands for the Kaurna people and that we respect their spiritual relationship with country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. Also welcome others joining us online who might be on other lands today. Thank you and welcome. So for those of you unfamiliar with CEIH, or the Commission on Excellence and Innovation in Health, we are the lead agency for innovation in healthcare in South Australia, and we love bringing consumers, clinicians and other collaborators together to turn ideas into better healthcare. Our vision is tiny. It is, together, let's create better healthcare for South Australians. We know to do this, we need to support the sector to come together to imagine new ways and new ideas for better healthcare. And we acknowledge that better isn't always excellent, but we commit to working together to measure what we're doing so we can see the changes that arise. So what if the big idea was connecting all the small ideas? This really is the essence of why we host the Innovation and Improvement Showcase. We want to help connect people in South Australia. It's about sharing improvements, innovations, and sometimes both. During the series season, sessions are every Thursday at 1 p.m. or available online at any time. We bring healthcare teams together and provide that space to explore what others have learned. And we really want to try and keep it simple and share work that's happening across the sector at any stage or any level, and not just waiting until work's 100% complete or published. We focus a lot on our work here in South Australia and celebrate our successes and our learnings, and sometimes we share ideas outside the state to ignite some broader ideas. So if you've got a story to tell, or you've succeeded in solving a problem, or you've learned something while trying, or you've got an idea for a theme you'd like explored, please let us know so we can look at it for the Improvement Innovation Showcase series. So this series 11 is on workforce wellbeing. Why is CEIH interested in workforce wellbeing? It's a fair question, but for us, we know our healthcare workers need to be safe and well, not only to thrive in their professions and have the bandwidth and capacity to go beyond and continue to innovate and provide world-class patient care. So we're committed to using global best practice in the South Australian context and supporting our sector to create a culture of wellbeing at all levels. So to support this, we've produced a range of resources and tools that are available on our website. Importantly for today, we are in Series 11, as I mentioned, and we are up to our third episode for the series, which is Healthy Workplaces Strategy, Employee Wellbeing and Work Performance. And I'm really excited today to be joined by two colleagues. Kylie Cox is the Acting Manager for Healthy Workplaces in Wellbeing SA, and Dumalaon-Canaria is the Healthy Workplaces Advisor from the Office for the Commissioner for Public Sector Employment. So welcome to you both. I'm going to stop sharing screen and I believe hand over to Kylie to kick us off for today. Welcome everyone.
Take myself off mute. Just check you've got volume from me okay? And slides okay? Great, thank you. Thank you so much for that welcome, Nadia, and welcome to everybody who's online watching today. It's a great pleasure to be here. I would also like to acknowledge that the land that we're meeting on today is the traditional land of the Kaurna people, and pay my respects to elders past, present and emerging. As Nadia said, my name's Kylie Cox. I'm the Acting Manager here at Wellbeing SA, working on the Healthy Workplaces Strategy and Work. And Wellbeing SA, for those who don't know, is a prevention arm, I guess. We're really looking at how we can prevent and promote positive health and wellbeing. And our department's made up of not only health promotion, but we also have an early years team, mental health and wellbeing, and a great team that looks after all of the epidemiological side of things. So there's around about 150 employees here that work at Wellbeing SA. And today in particular, I'm going to be talking about the Collaborative Partnership for Workplace Health and Wellbeing and the Healthy Workplace Strategy. And so in this work, I should also acknowledge Nadia and Isla, who were great ambassadors and advocates for this program a really long time ago. And I guess it shows the sustainability and the work that's been undertaken in this area. SA Health broadly has been really very interested in workplace health and wellbeing for over 10 years. I could probably say nearly 13 now, since I've been around too. And so this work that I'm going to be talking today has got some long-standing relationships and values that sit behind it, which has been fabulous. And as the world changes and as we progress, so has this workplace strategy. So first of all, I'd like to start off here just by explaining how this has all come about. And the Collaborative Partnership for Workplace Health and Wellbeing are a key enabler of our success around healthy workplaces here in South Australia. In 2019, 2020, this group of people come together. So 5 government agencies and 3 non-government agencies working together to create the Workplace Health and Wellbeing Charter, as you can see on the slide here. And the whole initiative, I guess, for this group, similarly to the CEIH, wanting your goals to be, as the outcome is for South Australia to be the state of safe, healthy and thriving workplaces. And that's what we're aiming to achieve as well. The real positives, I think, from this group is that there's strength and expertise across all of these agencies. So you'll see shortly that when we're talking about healthy workplaces, it's bringing together multidisciplinary teams. There's so much intersection across government agencies and these organisations. So we've got sort of like the employee voice coming through SA unions. We've got the employer voice coming through Business SA. We also have the Centre of Workplace Excellence bringing along a research lens and their really strong connection around diversity, inclusion and human resources. And then across the government agencies, we've got both Return to Work and SafeWork, where Joanne is at the Office of the Commission Public Sector Employment, and also Department for Innovation I should have updated that slide. Now they've had their name change. And so it's a really great group that come together on a quarterly basis to work through how can we create this better system for healthy workplaces in South Australia. So in 2021, there was a 5-year investment to support a statewide strategy for workplace health and wellbeing. And so the partners that I've just showed you have come together to work on this healthy workplaces strategy framework. So like I said, our vision is to be the state of healthy, safe and thriving workplaces, with our goal really around promoting worker health and wellbeing. And we've got 3 core objectives that we work on underneath the healthy workplace strategy. And that is that we're looking to raise awareness to the business leaders in the community around the importance of a healthy workplace, how they should create a healthy workplace, and what support services are in place to support them. The second one is around increasing the capability of business leaders, and whether that be HR, business owners, work health and safety, anyone who has got the lead of workplace health and wellbeing, to build their capacity to ensure that what they're putting in place has got some evidence base behind them and is going to be sustainable and ongoing within their organisations. And the third one is around contributing to the holistic system. And the way, of course, we do that in terms of strengthening that system is through the collaborative partnership, and where we can work with industry associations as well to ensure that that system is quite strong across multiple levels. We've got a great few number of outcomes now, I guess, that I'll go through shortly. But just to bring you through the model that we work under for healthy workplace. Healthy workplace is very similar to the model that's been put forth from CEIH, and I would Also highly recommend you have a look at the resources that CEIH have put together around worker wellbeing, because they are certainly fabulous in working through this approach to create sustainable change. The model that we look at in our healthy workplace model, very similarly, is an integrated approach where both physical health and mental health need to be considered together side by side. And I would say definitely over the last 5 years, that element of mental health, psychosocial safety and psychosocial hazards is coming through so much stronger now. You know, my personal belief is that COVID had a lot to do with that as well, in bringing the mental health aspects quite high, but really important to think about the physical health of mental health at the same time. We also in this model look around that integration across multiple, I'm saying multiple agency functions, but multiple functions in terms of work health and safety, HR and workplace health promotion, all coming together to create a fabulous system. And interestingly, when we ask people what businesses in particular, what's going to drive you in workplace health and wellbeing, where are you going to get your leaders on board with this, and we will put it to them. Would it be the fact that it's work health and safety because you're looking at reducing injuries? Would it be more related to human resources because you want to create this culture of care, and you're looking at reducing absenteeism, you're looking at keeping staff employed for longer and keeping your retention rates? Or from a health promotion perspective, you're looking at creating a positive, strong and healthy workplace. And it's really now becoming actually all three. We used to get probably 5 years ago that it was very WHS related, and certainly now the HR and organisational development components coming together. But I would have to say that we're certainly making crossroads of these three areas coming together really strongly. The third element in our model that's important to see here too is the integration amongst these three areas of healthy people, places and vision. And so that is when you're looking at putting a healthy workplace strategy in place, we don't really just want to be sitting down in this people element of looking individually at how we can support individual people. We also need to be looking at the environment that people are working in, and also what's the culture that's being supported by this organisation. What are the values, policies and practices that are in place? And again, I would have to say that we're lifting out of this place, lifting out of it being around people, individual people, where we would initially be giving people gym memberships. We might be giving people the opportunity to see an EAP, and that would be as far as our workplace strategy would go. There's a lot more conversation and work happening now that's looking at good work design, ensuring that the design of buildings are structurally in place and are supportive of safe working environment. What's the physical place that people are in that is actually going to create better health and wellbeing for them? And then from the vision and culture perspective, we're certainly knowing now that there's a lot more to be said around that leadership component that sits underneath healthy vision, as well as the policies that support that, the culture that's working behind creating a safe system, a safe place for people to come and work, from a safe, healthy workplace for people to come and thrive. And when we talk about healthy workplace too, as most of us sitting on this call here, scarily enough, we spend a third of our lives at work. We're at work pretty much from the age we're 15 or 16 up until we're 67 now from a retirement age. It's a long chunk of our life. And so there's a great time that we need to be able to try and support workers to be at their optimal level from a healthy workplace perspective. And this model is one that if you can bed it down and put it into practice in your agencies, we're going to see great benefits and results, not only for individuals, but also for our whole organisation. And from the perspective of healthcare organisations, for your consumers and your patients. So I'm just going to talk about some of the products and services now that are available that sit underneath the Healthy Workplaces strategy. So not only do each of our organisations in that collaborative partnership have their own tools and resources and supports, there are some that we've come together quite strongly in a collaborative partnership approach. So the first one I'd like to talk to you about is the Healthy Workplace service that is a relationship now across 5 key organisations, the 5 government organisations, that is available for all businesses, agencies, organisations across South Australia to create a healthy, safe and thriving workplace. And the link there is there for registering. To give you a bit of an idea how this works, as an organisation will jump onto the website and they'll register their interest for support. You get asked a couple of questions in terms of where you might be on your journey, what topics you're interested in. And one of our healthy workplace advisors will follow up with a phone call and begin to work with the business around how they can support workplace health and wellbeing. So Joanne's going to be talking today. She's our healthy workplace advisor at the Office of the Commission Public Sector Employment, and looks after all of the public sector organisations and supports them through this process. But in general, at the moment, we've had about 120 businesses since October last year who have come through the Healthy Workplace service that we've supported. This includes a Healthy Workplace advisor who sits at the educator arm at SafeWorkSA. We've got Amanda, who's at ReturnToWorkSA, myself and Sharina here at Wellbeing SA, and we have Joanne. And then the DIS team are the triage components and have got really great connections out with community and the regional development associations and through their small and family business hub. So I'm going to talk shortly to that service in terms of the questions that we've been asked to present on today in terms of that innovation and co-investment and design. But that's one of the great services that are out there. The second one that I'll bring you to is our Healthy Workplaces Toolkit. This is available on the website. You'll be able to find that the model that I just spoke to is on there, as well as the steps to help you create a healthy, safe and thriving workplace. We'll take you through a 6-step model in setting up a healthy workplace strategy. So you can either download the toolkit as a whole, or the other alternative is individually go onto each page. And the action areas that we've got in the toolkit do fit underneath the healthy lifestyle model, including smoking, nutrition, smoking and vaping now, but we know that that's so huge as well, alcohol, nutrition, and physical activity and sedentary work. But we've also included sections now around mental health, musculoskeletal, and sleep and fatigue. And those core areas speak to the model of healthy people, places, and vision. The next one on the slide here is around our community of practice. So this is an invitation to all of you who are listening. We hold at least 3 community of practice events per year. And the intention of the community of practice is to bring like-minded people together to talk about new research that's come out, what's been happening with the collaborative partnership. We usually have a case study presentation, so a business can talk through what they've done and how it's worked. And then we have some learning circle discussions and conversations. So a great opportunity if you're looking for a little bit of professional development and want to get with some like-minded people in this space. You can subscribe through the Healthy Workplaces website and you'll get always invited to our community of practice events. Our next one is on the 15th of November. And similarly to your next session, talking about job design and redesign, and I think the SMART model, which Joanne's going to talk to a little bit today as well. We're going to take a little bit of a spotlight on what's happening in that space, and we've got a great case study presentation too. The other one on this slide too is our Healthy Workplace Check. So the Healthy Workplace Check has been designed for 2 intentions. I guess as part of our Healthy Workplace service, we've got a strong evaluation framework behind that. And so we want to know whether businesses have made change by us supporting them. So the Healthy Workplace Check has been created with 7 key domains that we know that are important to create a healthy workplace. And the tool's been validated by CEIH, with the university supporting us to do that. It takes around about 15 minutes to complete. It asks you across the domains of leadership commitment, whether there has been consultation, and then it kind of links down into evidence that you might be using for your program around policies, programs, practices. So a really great measurement tool that just allows you to benchmark not the right word, benchmark, because you're not benchmarking against anybody else just yet, but be able to give you an oversight of a vision of where you're at in terms of creating a healthy workplace. And what we're probably noticing actually the most that we've seen out of that healthy workplace check data at the moment, the place where businesses are being let down a little bit is their data and evidence to support what positive outcomes they're having. And so by undertaking the healthy workplace check pre and post, it will give you some ammunition to see that you're making a change, but also allow you to see where you've got your some gaps happening across your organisations. So they're the four kind of main products and services that we have that are available. So I'm just going to show a little video here about the healthy workplace service, rather than me telling you too much about it.
Everyone deserves to work in a workplace where their health and wellbeing matter. And workplace leaders have told us that they've got pain points when it comes to delivering workplace health and wellbeing. And that is where we are here to help. Our service can save you time by pointing you in the right direction to the appropriate information that suits your workplace needs. We can help you identify the strengths and gaps in your workplace and save you time and money by targeting your health and wellbeing efforts. We can provide guidance around engaging with your employees to help protect their physical and mental health and wellbeing. We can support you to advocate and demonstrate to senior leaders that health and wellbeing is not just a nice to have, but part of a successful business plan. We can help to proactively design out hazards to physical and mental health and design in a healthy workplace environment and culture. And we're here to quality check. If you're a business that's doing something, we can review what you...
Oh, sorry. Did that just stop? Everything just stopped?
You've done and provide insights to help make it stronger.
Thank you.
The Healthy Workplaces Service is a collaborative partnership with experts in workplace health and well-being. The service has been designed for South Australian workplaces no matter where they are in the state, what size or industry they're in. We're here to help you navigate your workplace well-being journey.
The Healthy Workplaces Service provides free information, resources and support to build healthy, safe and thriving workplaces. We can help you to design a health and wellbeing program, address specific workplace health and wellbeing issues, and link you into services, resources and supports to promote workplace health, wellbeing and safety.
The Healthy Workplaces Service brings together qualified and specialist professionals from across areas of health promotion, workplace health and safety, and business services.
A healthy workplace has so many great benefits for the business, for workers, and the South Australian community. In a healthy workplace, we see that people are more engaged, more productive, and there are fewer work-related injuries and illnesses, less staff turnover, and improved health and well-being outcomes. We know that around 50% of South Australian businesses have some plan around workplace health and well-being, and our service aims to make it 100%.
Start your workplace health and wellbeing journey by visiting our website, healthyworkplaces.sa.gov.au. Here you'll find information, tools and resources and be able to register for the Healthy Workplaces service. Once you have registered, an advisor will be in touch to help with your workplace health and wellbeing.
There you go. So that's the end product, but how did we get there? And so when we were talking with CEIH about this presentation really is around co-design and moving forward together as a system. So I'm just going to go through a few slides now that talk about how the Healthy Workplace Service come together and what was the innovation behind it. So the need was identified first, and that was identified through previous evaluations and outcomes of prior programs. So as I mentioned, SA Health's been working in this space for quite some time. So there was the Healthy Workers, Healthy Futures initiative that happened from 2014 to 2018. And there was a great evaluation that was undertaken in there, which continuously demonstrated the need for us to be able to provide support to businesses around their health and wellbeing journey. The second thing I think that really was quite strong in helping us identify this need was community consultation. And so quite a large community consultation had occurred with 250 workplaces, asking them around what their strengths were, what their barriers were, and whether they would think that a healthy workplace service was going to be useful to them. And the response back from that was really positive. And I guess some of the particular barriers they have is around time and capacity to actually get their teeth stuck in to doing healthy workplace work. And this is where the service also helps, because we take away some of those pain points for business. And the third reason, the third way that things were identified for us to put a case forward around creating the healthy workplace service was literature. We know that a well-designed healthy workplace environment has a positive impact on our community and health and wellbeing. We know that there are 97% of people living with a chronic disease within our workplaces. And so all of these literature and statistics help put together the case study for this to move forward. And this is what it looked like. Nothing, these things like healthy workplaces take a change management process. So the steps that we've gone through to get to this point, and I encourage you all within your organisations too, that it is a change management process, and just keep on chipping away through these steps and you'll end up having a really fabulous outcome like we have now with the healthy workplace service. So as mentioned, a project proposal was put forward after we had all of this evidence, which gave us the impetus to be able to move forward and to have be able to be successful in gaining some funding. The second thing that happened was a co-design workshop. And the co-design workshop was so important for us to ensure that we had all of our collaborative partner members involved in giving us input to which way the model should look. How important was it for us to set up the model with government agencies, what particular topics we should be looking at. And so that workshop was just really, really relevant and key, but the co-design element didn't stop there, but it set us up for really great working relationships and open communication. Following the co-design workshop, we then went into our executive directors, having meetings with other executive directors to talk about this aspect. I think it was really important for us to have a co-funding model where different agencies were putting in for this. It really heightened the importance around wellbeing. It's one of our key leaders when we're talking about at a business level that we need to have leadership commitment. Well, we needed our organisations to show their leadership commitment. And the way that they did that as well was through being able to support funding for these positions in the healthy workplace service. Our next few steps were more about service design and what we wanted that design to look like. And that included doing empathy mapping and customer journey mapping. So we wanted to make sure our service was to the needs of our clients. And that process helped it look at small, medium and large businesses. Where are the pain points and how are we going to help overcome them? This then led us to have MOAAs with all of our agencies that are working towards this service. And we then have got a steering committee that's set up, so a co-funding steering committee, who's now up to around about meeting 13. So like I said, this co-design did not stop. Once we've had the MOAs in place, the co-design steering committee have come together to create the service blueprint, which is the model and the way that we work in for the healthy workplace service. So we meet on a monthly basis, we come back in and we talk about any issues and problems, what's the future going to look like. So great collaboration across multiple agencies for this outcome. This time process, I think, has taken around about 2 years to get from start to end. So it's great to see the great benefits now that have come from working in this partnership. So like I said, the benefits of working in a collaborative approach is that there's always benefits around the extra funding. So instead of us having 2 positions, we've now got 4. So it's given us a lot of extra capacity in terms of people power, but it's also given us a great variety of skill set and expertise across multiple agencies. And that's been really important because health and wellbeing, as all of you I'm sure know, is really broad. And there's so many different elements and facets. And in terms of our advisors, you know, we've got someone who's a physiotherapist and someone who's a nurse, someone who's real WHS focused. We've got Joanne, who's really strong on mental health and wellbeing. And so we've got a great skill set that comes with working in a partnership and working in co-design together. And the fourth benefit, I think, for us in particular is that we've got a wider reach to stakeholders. And so by us working along these collaborative partnership members, we're actually, I always think of us as being an octopus with multiple tentacles. Our reach is so much further in being able to get out to all of the different businesses across South Australia. It's always important to understand the evaluation components. And like I said, for the Healthy Workplace service in particular, we're predominantly using the Healthy Workplace check to see that we have got change in knowledge and skills around healthy workplace leaders in making change. It's not the only thing that we're utilising though. You have your general process numbers of how many people are coming through the service and what they look like. But really what's important for us too is the storytelling that happens behind the scenes, the relationships that are formed, the case studies of change. And I think that's something that certainly we undervalued to begin with, but that's something now that we're looking at so much closer, that with workplace health and wellbeing, numbers can tell a small picture, but it's actually the stories that go with it that tell so much more of the picture of the positive change that you're making. So my key takeaways before I hand over to Joanne is really that you're stronger together. It's really important to use your skill sets across agencies and departments. So it's really great to hear the work that's happening through CEIH, but even individually from within your organisations and your agencies, bringing together WHS, injury management, HR, your executives, your managers and your employees is really key to be able to get those skill sets across all divisions. It's also really important to learn from others rather than reinvent the wheel. Like I'm a strong believer that the challenges that we're all having are universal challenges. It's not different. Like health doesn't change from one place to another. And so when we're looking at investment in this area, it's really great to learn from others. And so again, I'm just going to refer you back to the CEIH materials because they are designed for healthcare and what's in there is really pertinent to your areas. My next point is about short wins. Be prepared for those short wins, but ultimately workplace health and wellbeing is a change management process and it does take time, but the small things are sometimes the ones that kind of fill your bucket and make you feel like you're being successful and then can continue on with your momentum whilst you're also working on the longer ones in the background. I think that momentum in this area is so key. So just look for those short-term wins that are going to make you feel good and make the organisation feel like they're achieving. And last one, you can't, if you don't get funding really, if you're not measuring. And as we're seeing, this one is one that's falling off the radar a little bit. So really important for you to keep as much as possible case studies, get emails of appreciation, any surveys that are showing improvement and pull them together. And I would refer you again to the CEIH resource that is all around evaluation and monitoring of programs for some really great insights on how you can do that the best. So that's my part of the presentation. I'm going to keep the slides going, but hand over to Joanne to continue on now talking about her role as a Healthy Workplace Advisor for the public sector.
Thank you so much, Kylie, for getting the ball rolling. And it's so great to always hear the history and background of the collaborative partnerships for workplace health and well-being. You spoke so eloquently about what we've done and what we've accomplished. My name is Dr. Joanne Dumalaon-Canaria, and I'm here to share our experience in the Healthy Workplace Service, working for the South Australian public sector. While Kylie is uploading, or is the slide uploaded? There you go. Next slide, please. I would also like to pay my respect to elders past and present and use the Ghana language that was taught to us by Jack Buckskin. Ngay nari Joanne Cartanya, Marni Ngadlu Tampinti, Ngadlu Ghana, Yertanka in Parenti. Language is important in sustaining Indigenous culture. And I was chatting with a historian the other day, and I was just so amazed at the innovative ways that Aboriginal people have taught us, and it's a really great way to honor them. I'd also like to take this opportunity to share with you a personal experience. My mom is a retired nurse, and growing up, I remember the many conversations that we've had about the joys and challenges of work, and it made me reflect on how important the employee experience is. And as Kylie shared earlier, and as Nadia did as well in her introduction, we do need to work together to develop healthy workplaces. Because of my mom, I am also biased, and I have to say that the healthcare sector is a very intelligent audience. So what I will share with you might not necessarily be new, but I do believe that our shared narratives across agencies give us that sense of direction, focus, and insights where we can work together. And a value of the collaborative partnerships, as Kylie mentioned, is that all of us who are members of the collaborative partnerships get together and bring our strengths to the table. The next slide might be familiar to you. So the next slide is all about, if we take a look back, one of the OCPSC resources that we have is the I Work for SA Your Voice survey, which you might have done in 2021. Statements such as, I understand what is expected of my role and happy to go the extra mile. I understand how my work contributes to the local health network objectives do sound familiar. You know what you need to do, and you know how to get the job done. The last two statements reflect acceptance of diversity and commitment to workplace safety. If we contrast that with our highest negative scores during 2021, I feel the level of stress in my job is appropriate, which reflects job pressures and demands. Employees also want to see action by their LHN and the public sector overall. There is also a need to be able to see leadership commitment. And the last statement, I think it's safe to speak up and challenge the way things are done in this LHN, speak about psychosocial safety. I had a chat with organizational psychologists / academics yesterday, and we were talking about the importance of looking at data trends to see how far we've gone, how we can monitor it, evaluate, as Kylie mentioned earlier, which are the strengths of CEIH. And it's good to be able to do that, to see how far we've gone and the gaps that we still need to address. And so in the next slide, yes, so we can see what's working, and how we can further address the key needs and concerns. So for 2023 at OCPSC, we have the People Matter employee survey, and this is it's similar to in 2020. It's just that there's a name change so that it's not confused with the Indigenous Voice referendum. And it's a good way for us to be able, like what I said earlier, to see those trends. And very exciting for work health and safety, last Monday it was announced that we have amendment to the model clause and regulations when it comes to psychosocial risks, and the hierarchy of control in managing psychosocial risks is included. Next slide, please. And so how does that look like for us in the public sector agencies? To give you a context, we started our Healthy Workplace Service meetings in the public sector in March. At present, we've met with 15 public sector agencies and have had conversations with 2 local health networks. if we map what we are doing, we can see that we're strong in the encouraging and education space. We have our EAP, we have our education training, we have our health and lifestyle programs, which is good. We need options for people to be well if they are unwell, and for people to stay well. But those strategies in the hierarchy could be termed as voluntary health practices because they are dependent on the individual response. And what the hierarchy of control for managing psychosocial risk is encouraging us to do is to deepen our level of maturity and ask, how can organizations respond? And so that idea of redesign the work environment for safety, health, and well-being is so important. If you're familiar with the fishbowl analogy, we've heard that many times with one goldfish unwell, the other well, but if they're in the same dirty water, you can just imagine what the outcomes would be. And so we need to be cognizant of, what can we do to develop our ways of working? What is the organization's responsibility? And you could see in the hierarchy that redesign is in the middle, which makes perfect sense because it can allow you to think about, higher levels in the hierarchy. What can we substitute? What can eliminate? And if you look at the encouraging and education piece, what are the strengths there that could be part of our ways of working instead of it being a voluntary or a quick fix solution? So looking at the hierarchy of control, perhaps you might be thinking about design ideas that we can apply to our ways of working so that we could prevent harm. Next slide, please. So there are many tools out there, but one of the tools that we've been following and what we've been excited about, and I also heard from Isla and Katie about this in the first series of our well-being sessions, is that, the idea of work design. We've been following the work of Professor Sharon Parker, and I'm not gonna delve into this much because I know that Katie Thomas is our next speaker for next week. So I encourage you to log in and watch her presentation so that she could further define what the smart work design is. The beauty of the smart work design framework is that it can cover, and there is evidence that shows that it can cover psychosocial risks. Next slide, please. So what I did was, we've been having these conversations with LHNs, and I mapped our conversations and matched this with a smart work design concept to see and share with you that your leaders have been thinking about the smart work design concept or work design in general. So stimulating means, what can we do to enhance our variety at work? How can we incorporate people's interests? In one LHN, a manager was sharing her thoughts about perhaps we can have a pool of shared jobs to keep people interested, particularly for highly administrative roles. The next would be mastery. What can we do so that people understand their work better? When we speak of mastery, feedback is so important. And it makes us reflect on how we communicate. Is the communication, the feedback perceived positively, or does the person feel like they are being micromanaged? Role clarity is very important here because two people, the leader and the employee, if they have different perceptions about what needs to be done, then that can be also a form of psychosocial hazard. And also mastery, how can we learn from top performers in the field? in terms of agency, do people have influence over key decisions in their job? Do they have opportunities to show initiative? Relational, do people feel valued with their own teams? I have a psychology background, and I've listened to so many stories where people left the organization because of poor relationships. And so one leader from an LHN was sharing with me, we still need to work together to create that strong team environment and get that energy going for stronger relationships. And tolerable, what support do you need? How can we do things more efficiently? Is there a way that we can improve our process? And in managing workload pressures, if we increase our stimulating mastery agency relational aspects, which are job resources, then even if we're busy, and in health, you know how the demands and pressures can get, but if we have resources there that could support the demands, then you see a balance, an equilibrium would be achieved. Next slide, please. Yes, and other insights that we've been having is, again, similar to that conversation that I had with an LHN leader. The coaching conversations is important in innovative design. How do we make people curious? How can we make you curious? How can we make you feel excited about your work in a sense that you'd want to share your ideas? The collaborative leadership approach is important. Helen Galindo, my manager at the Healthy Safe Workplaces team at OCPSE, we encourage leaders that when we have healthy workplace service meetings, to have a representative from HR, OD, safety and well-being there. Doesn't always work all the time, but recently we had a meeting with this particular agency, and you can just feel the difference when everyone that has skin on the game is present and they're all on the same page with regards to their strategy and how we could further develop well-being at work. With another agency that we're working with, I found this quite innovative, that a safety leader wanted to, aside from the other leaders that are present, she wanted to bring in a frontline worker and an HSR in the meeting so that we could be more cognizant of the employee experience and the need to be able to listen to them. And #human, the intersection between life and work, in a community practice event of the collaborative partnerships for workplace health and well-being. We had Mark Leopold there, who worked for Beyond Blue and now works for Transitioning Well. And he talked about, the intersection between life and work, that where we are in the life cycle affects us, right? I'm a full-time working mom. I have a 10-year-old and a 3-year-old. Having autonomy in the scheduling of my tasks is important to me. And I'm quite privileged that my office respects that. And young workers, for example, do we realize what they want and what they need and how we could support them? Workers who find themselves in a sandwich role between caring for an older relative as well as caring for kids. And just lastly, these are use cases on how we could further support you should you be interested in a Healthy Workplaces meeting. So please register. Kylie walk you through all of the expertise, the resources, the toolkits that we have. A very popular request from us as a Healthy Workplace advisor for the public sector is to be able to review and provide feedback on agency well-being strategy. We also have OCPSE resources and expertise. If you're interested in knowing more about work health safety, injury management, I'm part of the Healthy Safe Workplaces team led by Helen Galindo. We also work closely with Caroline Tingle and Lisa Devine, who are developing the People Matter employee survey. And yeah, we also work together so that we're aligned with our communication and strategy. If you're interested in the smart work design, after you see Kylie's presentation next week, we have also developed resources on this. And lastly, and this is my final slide, we have an in-person event. So Professor Sharon Parker is here, and our commissioner, Irma Ranieri, who has expressed her leadership commitment and support to the collaborative partnerships. She included a healthy workplace service strategy in her recent sector update sent to CEs. And so she will have an on-the-couch session with Professor Sharon Parker on the 10th of October. You might have seen the IPA whole of government announcement. So thank you. Thank you again for this opportunity to share the valuable work that we do. And just like what Nadia said in terms of the vision of CEIH, yes, collaboration is important, in their vision of creating better healthcare so that we are able to serve our South Australian community.
Hi, thank you so much, Joanne and Kylie, for a fabulous presentation. And thank you all for joining us for this session in our Series 11 on workplace wellbeing.